Mile Bluff is a sole community healthcare organization that has clinics, a hospital. We have 2 nursing homes, assisted living, retail pharmacy spaces. And so our whole goal in everything that we have is to continue the continuum of life. So we go from birth to death, in a sense. So we make sure that that's kind of serving the whole community through the facets of life.
And fortunately, our organization has felt it important to invest in what the community needs. I think what happens is we lean really heavily on the people that know that the best, and the people that know what the community needs the best are our staff and our physicians and providers, because we're every day talking with people from all across the community, people from all walks of life in our community, and that way we can identify the needs, make investments where our needs are, and the community sees that.
There are a lot of construction things we have going on right now. We started kind of slow. You know, we painted the hospital, we put up canvases, and we watched really how the employees and the patients were noticing a change, and we're getting excited about it. You know, and those were small, not very heavy financial lifts to do that. So then we really decided, what do we need to do? And we've seen great things come. There's excitement, both in internal and external, community and staff, you know, really looking at what we need next and how to better it. And we wanted to show the community we're willing to invest.
When we moved to Expanse, I was one of the first ones to raise my hand to say, hey, can I help with this? And really with Expanse, it's a very intuitive product. It's easy to learn, it's easy to adapt and implement.
So many of the beautiful things about Expanse is having access to the labs, to the radiology information, and all of that flowing into my notes. So the ability for everything to flow into the note is a huge time saver, and not to mention it improves quality.
Partnership between Google Health and MEDITECH and Mile Bluff. This is going to be, I think, a tool that's embedded within Expanse that's going to put us to the next level as far as healthcare and as far as patient satisfaction. I can't be more excited about it, really.
And what really attracted us to MEDITECH Expanse was the full suite in itself. When we're getting into a new system, we needed to somehow lean on expertise to get some streamlined processes. And when we chose the MAS product, that's what we were hoping to get, and we did. That set us up for success in being able to see our patient through the continuum of care using MEDITECH Expanse. And the model itself, obviously the price tag is smaller than a big conglomerate person that won't even have anything to do with us, which didn't make any sense. You know, so partnering with MEDITECH, we knew that we were important to that product, period.
MEDITECH Expanse allows you to be paid for the work that you're doing, and if a different rural healthcare system does not have a program like MEDITECH Expanse, they may be losing, as we know, thousands, if not tens of thousands, if not hundreds of thousands of dollars. MEDITECH Expanse has done a tremendous job in helping us.
One of the things that I'm looking forward to the most is the growth. We have so many exciting opportunities. We have done a great job in our OB labor and delivery with our water births and expanding our center there. Our infusion and cancer care department is growing by leaps and bounds. I think the growth of the hospital and some of the remodeling and the new projects with moves to other locations is exciting for us. The complexity of the patients is higher than it's ever been, so they feel at least that we are providing them with the right tools to be able to do a great job. I think Expanse has given us an opportunity to find efficiencies, streamline our workflow, allow us to spend more time with the patients, and we've been able to utilize it in a way that has allowed us to do that.
What does the community need? What do we need to provide to our patients to keep them here and keep them comfortable, where they know that they're safe and they're getting the highest level of care, but within their community? That's one resounding comment that I've gotten from travelers that have been at other facilities, is how impressed at how much we do here and the equipment and the technology that we have for such a small organization. And it's something we take a lot of pride in, because we want to be the best, as silly as that sounds, but we want to make sure that we are providing the safest care in the best way, and we have the best technology and EHR to support that.